We'll call this workshop to order. Can we have roll call, please?
Yes, Vice Mayor Klobstad,
Here.
Councilmember Henderson,
Here.
and Councilmember Pallavi.
Here.
And I'll note Mayor Zabriskie and Councilmember Romack is absent this afternoon.
Okay, do we want to do a Pledge of Allegiance? We'll skip that for this time. Okay, public comment. So is there any member of the public that would like to make a comment not on today's agenda? Seeing none. And then we're right into the workshop discussion, which is extending healthcare benefits to town council members. And the recommended action at this point, if you want me to go ahead and say it, or you want to take it over and...
Yeah, we're gonna take over
Okay.
because this is a workshop. I mentioned this at the council meeting. You didn't have a staff report in advance, so Bonnie and Steve and team have gotten together a presentation for you. If there's information that's missing and you still would like clarity on, it would be helpful to know what that is now. If you direct us to come back at another meeting with follow-up on this, we could include it at that point. I do want to point out Steve Conway, our interim administrative services director, is on Zoom, so he is available for questions in addition to Bonnie. And then this is being recorded for members of the public at home. The purpose of a workshop, you cannot give us direction or vote on this tonight. So I want to make sure that's really clear this afternoon. Sorry, we're used to evening meetings. We aren't voting on anything. You are reviewing options for extension of healthcare to council members and elected future council members. We will show you the range of options that are available. If you can have some dialogue around that and provide us with some feedback on what ranges you're interested in, and if you are interested, and then if you are, then bringing that back at a future public meeting or regularly scheduled meeting. We aren't, as a reminder, we talked about this at the last meeting, but we are not having a meeting on December 24th. There are no more regularly scheduled meetings this year, so the first opportunity would be in January at the January 14th meeting.
Perfect. Thank you for making that clear. I appreciate that. Hey, Bonnie.
Okay, with that. So the town of Truckee participates. Oh. No problem. Let me know when you're ready. Okay. So the town participates in the CalPERS Health Program. And what that means is that in our area, town employees only have eligibility for essentially two plans. There is a PORAC plan that is available to sworn police officers. It would not be something that council could opt into if you were interested. But based on that, there are two plans that are available in our area, the Gold plan and the Platinum plan. The Gold one is the more affordable basic plan, and you can see from the number of town employees that have enrolled in that plan, it's the most cost effective for both the employee and the town. And if we're looking at just taking out the sworn police officers, 92% of our employees are on that plan. So here is for 2025, these are the monthly premiums for the two different plan options based on how many family members are enrolled in each plan. And what this is showing in the range options for monthly premiums is kind of giving a framework for how our town employees participate in cost sharing for some of this health insurance. So this is how it's negotiated in all of our MOUs. And in each MOU, it's slightly different because over time, employees have bargained for more wages or other benefits or more money towards health insurance. So each town employee bargaining group pays a little bit different amounts towards each of these different plan options. But you can see in general that the single employee plan on the more affordable Gold plan is fully covered. And then they pay an increasing amount based on the number of family members that are covered. Or if they choose the Platinum plan, which is more expensive, they're starting out at a higher number from the get-go. So we thought it would be useful to kind of look at our area. So we surveyed both our regional partners, there are local cities, as well as our special districts. And there's several different models here. So you can see at the top in the white, there are several other jurisdictions that don't provide health insurance at this point. We've included both the compensation for health and or dental vision insurance, as well as the compensation that board members receive for doing public business at meetings as well, as part of a larger compensation package. In the middle, we have some kind of different models of having board members participate and pay for a portion of the premium, or maybe the board is limited to only selecting the cheaper plan, or only having employee-only coverage. So there's some different versions in there. And then down in the darker color, you'll see that those agencies pay 100% of the premium for full family coverage. And then we had a few who I was unable to get survey data from. So, given that there's many different models available in our community, I thought I'd provide some potential options on how to think about funding for this.
And I just want to highlight, when we budget for our employees, if they are vacant positions, we are looking at a fully loaded, full family coverage to make sure that we're budgeting appropriately. So these numbers are looking at future councils in addition to this council, and assuming all 5 council members would take coverage at the maximum amount you would be interested in. So the numbers may not be actuals that are realized each year, because maybe not all 5 council members would take coverage, but that's how we typically budget.
And also just really quickly, with regards to the compensation, I know that we are limited in compensation raises to every other year at the 3% or the 5%, whatever. Yeah, we've been through that part. So the theory being, we can't really ever go down, for example, right? Would there be a trade-off? Because what I think on Bonnie's previous slide, you've got per meeting versus ours, which is just sort of a stipend, basically, right? And so we wouldn't really want to change that, because then we would go backwards into some other formula that would kind of mess things up in another way.
Here's how this works. The legislature has decided that health and welfare benefits are not counted against the salary cap.
Right.
So your salary is unaffected by whatever you do here. So you decide that council members should get health benefits. Your compensation as such is going to stay the same.
Got it. Right.
But I think what you're saying, if you wanted to add health benefits and not add salary compensation increases to kind of offset some of that,
Right.
we wouldn't go backwards, but we
Right.
don't have to do the increases.
Right. Okay. I guess that's what I was saying. And we wouldn't really be wanting to change it to that per meeting type of model that it seems like a lot of others.
That's
seem to use.
that's pretty uncommon for cities.
For cities,
as you
okay.
can see up here, that's a little more common for special districts.
Okay, yeah, got
Cities
it.
don't really do it.
And
Okay.
that's probably because they have one meeting a month. And most
Right.
special districts have one meeting a month.
Got it.
Yeah,
Okay.
and then how would we define it with all of our committee assignments and everything?
Yeah.
That would get
Yep.
really
Yeah. Okay. Just wanted to get a reminder on that. Thank you.
No, certainly.
Hey, Bonnie, do we, because I know you're going through the slides, but do we have that last slide as a printout by any chance?
I do not have it here today, no.
But we could
I can get it for you,
Okay,
certainly.
thank you.
And I can,
This will be posted for the public to view. We always post our presentations as well, but we can send you the link.
so this is just one potential way of looking at this. So this would be if you were interested in moving forward with this and interested in having 100% full coverage at up to the family level plan. So we did, as Jen was saying, we also budgeted in a 10% annual increase because that's how we budget for our town employees' increases. So CalPERS, over the years, the increases have fluctuated. They've been in the double digits for several years, but they did go out for RFP, and their provider is now Blue Shield, and that will start on January 1. And in that RFP, they demanded some pretty strict metrics to try and help them control those escalating costs. But the way the town employee contracts are written, the town will cover up to 10% of the increase, and then the town employee group is on the hook for the remaining portion of that premium. So 10% in annual increases are built into these numbers as well. So another potential option would be maybe you opt into just paying for employee or council member only coverage. In this case, the cost to the council members, which would be on the right, is significantly more because the one party plan would be fully covered. The council member would be responsible for the other portions of those premiums. But it does, decrease the cost to the town. Another option would be just a 500 or any number. This is just an example, a monthly flat contribution, regardless of plan type that you pick, however number of family members you're covering, to a contribution. So across the board, so 500. That gets you to about 6,000 in an annual premium for council members. But someone who's only covering one family member rather than a whole family would still be paying more than this option, which is based on the town employee model where it's kind of scaled. So you could see that in this case, the 3-party plan, roughly the same amount for an annual premium for a council member, but a council member who isn't enrolling any family members on a plan would have that coverage fully paid. So those are just some potential options to think about. It's kind of hard to look through those on all those slides. So I did take, based on assuming all 5 council members all enroll in the 3-party coverage, what this kind of cost to the town would be overall, just to give you some way to compare the 3 different funding options. And there are certainly, many other ways we could think about it too. That's annual.
That's okay.
Yep.
Hillary's printing these for you, so you will have them on your.
Okay. So if wanted to talk about potential timelines. So if council did want to move forward with this, as Jen said, we would need to take it to an open session, regularly scheduled council meeting, at which place you would adopt a resolution. If those resolutions are submitted to CalPERS before the 10th of the month, the benefits would be effective the first of the month following. So if, assuming a January council meeting, those benefits would be effective March 1st. And that's all I have.
Bonnie, thank you so much. Just to start off, first and foremost, thank you so much for taking the time to put that together. Thank you for the rest of staff for being here and helping walk us through this so that we can contemplate both the possibilities and the impact. So I really appreciate that. And hopefully, I know I shared the November 9th, 2021 agenda packet with Councilmember Henderson because I'm linked on her. So I don't know if anybody's had a chance to share that with Councilmember Pallavi. I think it would be really helpful. It was a very thorough presentation that time as well.
I remember it clearly.
Okay.
If the direction is to come back in a future staff report, we can link to that so everybody has it.
That would be great because it does have a lot of those breakdowns and the numbers are, pretty consistent still because we had projected out. So I thought that was very helpful. At least it was really helpful for me to review back on. So with that said, and my gratitude for the support of staff in being here on a non-scheduled meeting, including Steve. Thank you for being here as well. What questions do we have from the council?
I have a quick question on just the gold plan is dental. Where does dental, vision, any of that stuff, does that show up under any of that?
We did not provide any information on dental or vision. This is solely just the health plans.
Got it. And what would the staff, does the town employee pool have access to dental and everything?
Yes, it's through a separate plan.
Through a separate plan?
Yes, through Sun Life Financial.
Got it. Okay.
And there's also other benefits too. That's another thing that I think would be helpful to link to is the staff benefits package that's on the website. There's things like a health savings account and life insurance and a bunch of other things. And so that whether or not we want to contemplate any of those other packages would be important to discuss today and provide information to staff to base their next report on.
And just for context, the government code says that you can have benefits that are equivalent to benefits that are available to quote unquote large numbers of employees. So whatever is generally available to town employees is potentially available to you. And the statute that says that you can have health and welfare benefits defines that pretty broadly. It's hospital, medical, surgical, disability, related benefits, including without limitation, medical, dental, life, legal expense, income protection insurance, et cetera, et cetera. So there are a number of options as long as it's similar to what large numbers of town employees have.
Thank you, Andy. And another kind of, I think, overall point is, as I think we've researched some of the other cities that do provide broad benefit packages that include many of those things, one of the things that does appear to be clear, and if you could just validate this for me, Andy, that, for example, some agencies, and Town of Truckee included, if their employee has coverage elsewhere, you can get a 50% share of the cost of that benefit, but the council is not eligible for that, correct?
Yeah, that's exactly correct. So the Attorney General has looked at that question and over the years and has concluded that if you're just getting money instead of getting benefits, then that's not exempt from the salary cap that applies. And so that would get counted against the max compensation that you're allowed to have.
And so how is that different than just saying, rather than you're going to cover the premium, how is that different from saying we're going to cover $500 or we're going to have $500 towards healthcare?
Well, I think that the $500 approach that Bonnie was mentioning is the town in that scenario would pay $500 toward the cost of healthcare provided through the town, I think. Or were you talking about having to be?
That was having the council paid $500 towards
Yeah.
the cost of the healthcare and the
Okay.
town covering the balance.
Thank you for that clarification. I had thought it was reversed.
And just as a reminder, that was what was discussed previously, so that's why we use that as the example. The
Right.
stipend amount could be less than that, more than that, if that's the direction you wanted to go.
And then I have one more kind of legal question, I think, anyway. This was, I found this on another city's website about elected officials receiving compensation. One of the things that they point out is that if the employee wants to enroll in the PERS medical, then they have to be enrolled in PERS. Is that accurate?
I don't know. I'll defer to Bonnie.
That is not.
That is not,
So
okay.
there are two categories of people that can enroll in health. So one would be active members like employees here at the town, but you can also via this resolution opt into the health insurance portion without being members of CalPERS.
Okay. Yeah, and what research I've done, it does appear that most other compensation packages do include more than just health. It's also dental, vision, health savings account, and things like that. They're basically offering the same available options to their elected officials that they are their staff. So that's why I think the workshop was a really good approach to this, because there's a lot of those details to kind of work through and discuss whether or not we feel like that should be part of this discussion. So other questions?
So I thank you so much for the comparisons. This is so useful. And I think this is actually even sort of a step of detail above what we saw in the earlier report from several years ago, because that was sort of focused on, do they offer healthcare, yes or no? And this is really getting down to like the benefits themselves and the coverage level. So I really appreciate that. There's a lot of nuance there. Thank you. The jurisdictions that are in these comparisons, this is specifically focused on local, but I know before we had some other ones that sort of closely align with, like we do comp and class studies very regularly for our employees to make sure that their benefits are at market. So if we were to move forward with this becoming a fully agendized item at the January meeting, would we have the benefit of both these local comparisons and then also some of those comp and class studies in terms of the actual like benefits and coverage at those comp and class studies?
We could
Or
start.
not at those studies, sorry, at those cities that we usually include in our comp and class employee studies.
Yes, we could survey those agencies as well.
Okay.
I just want to, we will survey them and try to get answers, but, and share with you with information that they provide, if they respond.
And I think it seems like, because I've done a lot of looking and have talked to a lot of people over the last several years at like even the League of California Cities and the Policymakers Conference, different council members in other jurisdictions, it does seem like a lot of the benefits tend to be, they're public documents as well. So hopefully that helps and just makes it easier for us. I know that's not always the case, but I know several that are at least, and I could send you those as well if it's helpful just to make. Sorry, you said you had a question as well.
Yeah, you're fine. I'm just making sure that I'm following correctly in that option 4 is obviously the town employee model, and options 1, 2, and 3 would be above and beyond the town employee benefit package, at least specifically for health? No?
No.
Okay, help me
Option
then.
1, certainly. Option
Option 1 is the
2
only one above. Okay.
would be similar for the employee only plan. However, it would be more expensive on the 2 or 3 party plans because the council members would be responsible for the whole portion of the premium, or
I see.
over and above the employee only.
Yep. Okay. And then really number 3 depends on how many people you put on, I guess. Like if it's 1, then it's worse. If you're at 2, you're probably worse. If you're at 3, then you're better slightly. Right?
Yeah.
Okay. Okay. I don't think I have any other questions.
I want to make sure I follow all of that too. Go ahead. Do you have more questions?
Well, I wanted to make sure, one of the local comparisons, it's Nevada City, and I'm just making sure that's not the county, that's the city for their council members. Is that correct?
That's correct. We didn't include county data in this specifically because that's a more salaried position. So it felt like it was different. If you want that, we can bring it back in the next cycle.
Yeah, I think I'd love to hear your reactions on this, both of you. I think that would be interesting because even though I understand the intention is that it's more of a salaried position, the reality is that many of our supervisors have recently held full-time positions in addition to being a supervisor, and receiving the benefits with that, just as we all have full-time positions. So I think it actually is a comparison that I would personally like to see.
Yeah, I would agree.
Don't think Placer would be like the most comparable option.
But our county,
yeah,
I think
our
certainly
county's
is
fine.
a reasonable.
Yeah.
I mean, our district supervisor has held a full-time position for the entire past 4 years,
Yeah.
just
As
as we
many
do,
other
as
of
have
the-
many others.
Yeah.
So I think it's a reasonable comparison to include.
Sure.
Well, Nevada County is one of our comparable agencies for our comp and class studies as well.
Well,
so.
there we go. We already have it locked in. Thank you, Bonnie.
Okay, are we, no, I just think, are we done with questions for staff? Do we want to? So, okay, yeah, let's take some public comment on this, if there is any.
Good afternoon, council members and staff. I'm Barney Dewey. You probably know I'm on the Chiefs Advisory Committee and the Citizens Tax Oversight Board. I just generally wanted to say that I thought that that I support the health benefits for the town council. I think there's some, a number of positive reasons. I mean, we've seen some unfortunate in other local districts here, we've seen some people that are running only because they want the health benefits, and they've openly said that. And that kind of gives a bit of a pause, but I don't think it's really an important issue concerning the town council. The town council here, I think, has a much broader responsibility than any of the special districts. Not saying they aren't important. We certainly couldn't go without water or electricity and things, but the responsibility of the town council, I think, is much broader. You have to know a lot more about a lot of things. And I just think that it would be very, very good. I think that it's better for the productivity of the town council. If someone doesn't have health insurance and they have an accident or something, then they're probably going to be out for meetings and not being able to focus in on them. And I think that that's not good for the town at all. And I think the most important thing I see is equity. I think the town is very young, and so some of these compensation issues, haven't maybe grown up. I think I believe that the council is underpaid as well as the top management of the town, just by looking around to other areas. And by the way, when I was just looking around this, I did look at Mammoth Lakes, and you might want to include them because they're very similar, although they are about a third the size of Truckee. But they do provide, health benefits. Let's see. Yeah, how do you mention your responsibilities? Development, IT, public works, police, emergency service, housing, economic development. I mean, you all have to deal with those issues, which I think is really important. Yeah, and I would agree supporting more, looking at more of the agencies, towns, cities around. But in summary, from an equity standpoint, looking at that list that's up there right now, I believe you're being undercompensated, and I think the town has a higher level of responsibility, and that these other local comparisons are appropriate. So I'm for it.
I very much so appreciate your commentary, Mr. Dewey. Thank you. Actually, I do have one more just very general question for Steve, if you would. My understanding is you've been through this with another agency. Is that accurate?
Yes, I've participated in a number of agencies that had council or district provided health insurance.
And can you share any insights that you might have about the process that they went through in making the decisions about what level of benefits to cover and how it impacted that city's budget?
Honestly, in each of the organizations I've worked on, it was already a package that was available to council members. I didn't go through this process that Truckee's going through right now, where it's not a current option for council members. So this is relatively new territory for me. But I can tell you that, at least in the San Jose, Santa Clara Valley, most of the districts and cities all provide that. I can't think of one that doesn't, but that's in more of a metropolitan, major urban area. But I think it's fairly common. The one thing I did want to point out, though, was that if a council member leaves which I just for your information, if council member leaves the office, then they would be like terminating their employment. I'm using that word employment loosely, but they would then go on COBRA plan, eligible for COBRA. I confirmed that. I was trying to refresh my memory, and I did confirm that a council member would be able to go on COBRA for 18 months after separating from or leaving office if they, if that were to happen.
Thank you. That's good detail. And just for public education, can you explain what that means, what's COBRA and what's the benefit.
COBRA is the Combined Omnibus Reconciliation Act provision of the federal government that extends health care when you separate from your employment. In most cases, it's for people leaving their employment, and it does provide, if you've left employment and you don't have another, you're not joining another firm or another organization right away, you can stay on your prior employer's health benefits for up to 18 months, just paying you are responsible for the monthly premium, but you can stay on that plan for 18 months until you can find either get a new job where the employer offers health care or fund your own plan. But you do have 18 months to stay on your prior plan.
Excellent. Thank you very much.
You're welcome.
Okay, opening it up to council discussion.
I don't know if I have a lot more to discuss at this point. I mean, I certainly had some questions and really appreciate Bonnie, you doing that. I guess process-wise, the process would be if all three of us want to see this come forward as an agendized item, it would come forward in January. That's correct? Okay.
That's correct.
And I guess just from a discussion point, I would love to see I would like to see that happen. I would like us to move in that direction if you both support that. And as part of that, I would really like to see that detail on the comparisons that we've already talked about, that I asked questions about. So we have our local comparisons, but then also our comp and class cities. So for example, Mr. Dewey mentioned Town of Mammoth Lakes. That was in the last report several years ago. And getting to both the different benefits offered, so the full benefits package that those different jurisdictions offer, and then the coverage levels across all of those. I think that would be really helpful to have just all of that in the staff report that comes forward. I mean, I don't know if there's much more that I have to say, honestly. Let's hear from you guys and maybe I can add in, but that's where I am.
Could I ask a clarifying question on that? When you say full benefit package, you're expanding that beyond health, dental, vision, but other benefits that Anna was mentioning as well.
Well, let's hear from you guys, but I think what we have here, we see health, dental, vision. I think I would be interested in seeing a lot of other jurisdictions, and again, this is a lot of what I've learned over the past 4 years in office, just from other places, is their benefits offered to council are basically equivalent to benefits offered to employees. Sometimes there are differences because they have different plans. In some jurisdictions, department heads have access to one type of benefit. It's different for non-department heads, things like that. But I would like to see sort of I don't know if we want to like a package or whatever those benefits are offered within the different jurisdictions. Am I making sense? I'm not articulating it particularly
because
well.
like I have the website up now, and I think what we're talking about here is, for example, there's the flexible spending account benefit and the 457 plan. So is that what you're talking about? Is some of those other things and the life insurance? Because those are a little bit outside of the medical specific. If we're looking at the dental, vision, medical coverage, those are all pretty tied together, except for maybe the health savings account that kind of gets tied to that too. Have you pulled that up on the website? I'll send you the link. Do you have commentary while?
I guess, I'm fine with just the health, dental, vision, and maybe HSA, because I agree that's sort of connected. I think some of the other benefit is maybe above and beyond, and also slightly, I just think it's a big budget hit as well, potentially, and so I'm more interested in, I think for years I've just said, look, council members should have the similar benefit package as the town employee model. That's generally been my refrain. So if all of those things end up in the town employee model, great. If they're sort of like extras, that's its own thing to me. I've always just believed to be competitive, and when we look at this screen, it seems to be health, dental, vision seem to be the common pieces of the puzzle. So that's where I would land on that. I don't need to see 10 more comparisons. If you want to throw Mammoth and Nevada County on there, that is more than sufficient for me. What else? What other level of detail, I guess, is staff looking for at this point? Are you trying to narrow this down to 2 models? Are you trying to just have a discussion so we can have a discussion and you have better direction moving forward? I guess, how can we be more specific?
It's really up to you. The more direction we get today, the better prepared we'd be for a discussion in January. So if you can narrow down that you're interested in the gold plan versus the platinum plan, great. If not, you'll have that conversation. You're probably going to have that conversation again at a scheduled meeting anyways, but it would help us with filling in a resolution. If we don't get that level of detail to bring back in a resolution, then you have 2 public meetings because you have to give us that in January, and then we have to come back with the resolution.
So, I mean, with that said, I'm comfortable with gold personally, and I'm definitely not interested. I'm interested in it, but I think it's a bit egregious to go with the full coverage model, which I think was one. Much more interested, I guess, in 2, 3, or 4, and probably more in line just with the basic employee model, as that seems to be at least in my opinion, the fairest, easiest to administer, and most aligned with our staff. Let me know what else you want me to chime in on.
So I'm going back to the prior staff report where in 2022, anyway, they have this broken out by general employees, middle management, police, and then department heads. So what Councilmember Henderson and I had talked about was having equity with the department head level compensation package. And so that would be my preference, my direction.
We would need to do a little bit of research, I think, to figure out whether a package that is available to 8 employees qualifies as a large number of employees, which you recall is the requirement. Certainly you can match what's in any of the bargaining unit and MOUs, because those are large numbers of employees. Department heads are individual contracts, and there's a small number of them. So we need to poke around on that one a little bit.
Okay, let us know what you find out.
So I'll add in a couple of things. So right now, employees can select the gold or platinum plan. That's correct. So I would sort of, Councilmember Pallavi, I know you said gold, but I don't think we can make a decision on gold or platinum right now because we don't have those coverages in front of us, like the detail of those. So if employees can select, then I would like to see that as an option, at least.
I think that would still be an option to us. Bonnie, correct me if I'm wrong. It's just, what is the level that the town would cover?
Right.
Yeah.
And hold on. I do have information on the 2 plans, but what is?
On the last page of what Hillary gave us.
Thank you.
Give me one moment. It's just not loading.
No, I've got it, Bonnie.
Oh, you've got it in front of you?
Thank you.
Okay. So fundamentally, the 2 plans are very similar in that they have largely the same network of doctors. And I've been on the gold plan for years now, and I haven't had trouble accessing healthcare here in the region. So Tahoe Forest doctors are on both of these plans. The reason the platinum plan is more expensive is because they do allow for sorry, one second, let me get there so I can look at it too. what happens is if a doctor, when they're contracting with Blue Shield, is like, I'm not agreeing to pay these lower costs. I'm a specialty doctor. I charge more, essentially. They will agree to go on the Platinum plan. So you do have access to some of the more specialty doctors. And so those few employees that are on the Platinum plan have largely selected that plan because they have a specialist that isn't on the Gold plan that they want to continue to have access to care with. So there are some websites that can also allow you to see who's on what network. But it is so that the access to the same doctors is largely the same outside of those specialists. But if you look at the PERS Gold and PERS Platinum, so we're looking at the PPO, not the non-PPO side of this. You will see that when you're utilizing healthcare, the Platinum plan is more cost effective. You have a lower deductible, you have a lower maximum calendar out of pocket, and you have a slightly lower copay when you go visit a doctor. Of course, you're committing to paying more for it. So it's really a benefit for an employee who's a high utilizer of health insurance, who's using it a lot, and then perhaps has a specialty doctor that they want to have coverage with.
And I really appreciate that. Thank you, Bonnie, and seeing this. And I guess and perhaps I misinterpreted Councilmember Pallavi, but I think you were saying you were comfortable with, if it comes forward in January, just the Gold being an option. Did I hear that right?
No,
Or-
I don't care.
Okay.
I was reflecting more on what Jen was saying, which was tell us more specifically what you want. So
Perfect. And I guess the reason I'm just advocating.
you can elect into it. It doesn't matter. I agree. I don't think we would be, I think, buying into the CalPERS health plan that is available to town employees is probably the more reasonable way to say it than dictating Gold or Platinum. So.
Okay, I think
Thank
then
you.
we're aligned, because
Yeah.
I just wanted to, if this is a policy for future councils, we won't know if those future council members are in a high need of more healthcare or specialty care. So I just want to make sure that we're not putting it too much in a box, if you will.
Yeah, it's more related to what's the value or the number that the town is going to pay. So if they were to pay equal to the PERS Gold family plan as our basis, that's one number versus a premium or the Platinum.
And sorry, really quickly, are these 5 families in the comparison based on how many people per family? We didn't ask that.
A family plan is 3 people.
3. Okay.
It doesn't matter whether it's just 2 children.
Okay.
If you have a spouse and 2 kids, the 4th child is free, essentially. So it's really the number of people on the plan: 1, 2, or 3.
1, 2, or 3, and then 3.
3 plus.
I understand. Okay. And so these are just based on full 3 people, 5 person, all 5, 3 people per each of us.
Correct.
Understood. Thank you.
And I think, looking at this potential annual impact of $166,000 a year, that's kind of the maximum that we're talking about. I did do some quick calculations, and if all 5 council members were to take that, that's what it would be, which certainly that could happen, but it's actually not likely that all 5 at one time will take that benefit. So just in some numbers for people to consider, if it was that full amount, it's roughly $9.50 per constituent for the entire 5 of us. Another calculation is $1.90 per council member per person per year for our 17,000 population. And that's really just looking at our population and considering that this is a general fund expenditure that actually receives money from sales taxes and other types of taxes that hit our tourism base. So I think it's a really minuscule amount. It's also it's like budget dust in a $65 million budget. So those are just my kind of outside of the box, big picture, what are we looking at here? What are we doing? What's the long-term impact? Yeah, so that's where I'm at. What about you guys?
I probably should clarify because I just want to be a little sensitive to the narrative around the dollar amount. We look at per capita figures all the time as well, and I think it is an interesting way to perceive how much am I paying for police services. You know, that's always intriguing. You all know, and this is more for the public. We have Baker Tilly report coming out soon. Not sure what those recommendations are going to be, but there is going to be a probably large or significant cost implication to their recommendations. It's a big organization and they're going to have a number. So I just want to have it in context to that too. It's not that the $166 a year dollar amount for health coverage is an issue, but it will come to a place of having to say, we're going to do this, so we might have to defer something for another year.
Yeah, and do you mind if I jump in?
No, go right
I
ahead.
would just say I don't think we're trying to at all minimize the reality of these costs. That's why we're being really intentional about like looking at all of these different options. That said, I think again, I'll just say we do comp and class studies all the time to make sure our employees are at market. We have never really done that for council in a really we've looked at healthcare before several years ago, but it was just sort of a yes or no, these jurisdictions offer health coverage. We've never done sort of an equivalent process for council. And I think we're at the point, Mr. Dewey mentioned, we've grown up as a town a lot. There's a lot of responsibility. And so I would like to see a staff report come forward in January. I'm ready to say that, where we have different options presented to us. I'll say I think the options I'm most interested in are the option, I guess it was option 4 that matches what employees have access to here at the town. And then potentially option 1, because a lot of our local comparator agencies are at that level. So if we're talking about comp and class and bringing this council to market with other local jurisdictions, I think that makes sense. I don't necessarily need to see option 2 and 3 presented in detail because that doesn't really align with any of the other local jurisdictions I don't think with any of them, actually. So I'm personally interested in seeing option 1 and 4, seeing the benefits offered. I would like to know all the benefits offered at the different agencies that we're looking at, because again, it's, are we at market or are we not? So, and we might say, we're not interested in all of those benefits, but I think it's an important data point to say, okay, City of Mammoth Lakes offers XYZ to their council members, which matches their employees or whatnot. What are we going to do moving forward, and what are the cost impacts of that? That's where I'm at.
Agreed. Well said. Okay. Is there any other direction that you need from us?
So we're clear on like the cities that we want included in that, right?
Mm-hmm.
You guys feel good about that?
We will attempt to get that information. from
Right,
them.
sure,
Yeah.
attempt. We're clear on seeing the full benefits package, so we know where it is available, so we understand what is being offered in other jurisdictions, and the detail on the coverage level.
And I think, even though we're not considering some of the other benefits like the life insurance and 457 and all that sort of stuff, I think that's good information for us to have. Again, that's kind of on the level of a comp and class, and that's going to allow us to say, okay, we're not going to choose X, Y, and Z, and we are going to choose A, B, and C. Okay. Just to make sure we're clear on that too.
So from a process perspective, is your request that we bring back a resolution in January with option 4 isn't there? So you could, in theory, adopt that resolution to move us forward in the PERS process for healthcare coverage? Or is your request to come back with with no resolution, and you're going to continue the conversation about option 4 and 1 with the other comparators?
Well, that's a very good question, because if we do that, then it's 2 meetings.
It doesn't.
Yeah.
Okay.
The resolution itself doesn't have to say what the amount will be. It's just that you are opting into
Okay,
CalPERS coverage.
okay, great. So then,
But we need.
I think that's, if the resolution doesn't have to, are you saying the resolution can come forward, it doesn't have to say it, and then we can decide on the dais in January what is going into that? What are you?
Yes, but you will have to decide or
Right.
have another meeting to decide.
Okay. I think I'm comfortable with that if you guys are, because I think I also, it would be hard for me right now to be like option 1 versus option 4 without seeing all of those comparators. Like, I think that's a really important.
So you are asking for 2 meetings?
No.
Okay, we're doing the comparison, but we're going to give the direction at that meeting, and then Bonnie can develop the resolution to go to,
No, I was mistaken. The resolution doesn't need the amount in it.
okay,
It's
we're just opting in.
Yeah.
Okay, thank you. I missed that. Okay. Great. Yes, we'd like to try to get this done in one meeting so that we can be effective March 1st.
I don't think we need anything else.
Okay. Then I believe this meeting is concluded, and we are adjourning to January 14th meeting, 2025, because the December meeting has been canceled, correct?
That is correct.
Okay, thank you.